Dopamine is a neurotransmitter that is involved in a number of vital functions of the brain. It's involved in our reward centers of the brain, so when we experience pleasure, that involves dopamine release. But dopamine also plays a vital role in movement, and it's involved in what we call the basal ganglia circuitry. It's what helps drive normal activity of cells to fire together as one in a coordinated fashion. When the dopamine's gone, the cells can't fire as one. And so you have a very discoordinated firing or abnormal firing of all these different cells. Stimulating with electrical activity at those areas in that network where the cells aren't communicating properly helps allow them to communicate together again. And by communicating together again, that results in more smoothed out movement as we would normally see in someone who didn't have Parkinson's or didn't have a loss of dopamine. It's allowing those cells which aren't firing properly because they don't have dopamine to fire properly. So it's not addressing the root cause of the problem. Deep brain stimulation does not replace dopamine, but it's helping those cells fire with better coordination. But over time, the dopamine loss continues, and that's why symptoms may progress. And that's why we call deep brain stimulation for these movement disorders, and in the case of Parkinson's disease, as a palliative treatment. It doesn't cure the disease, but it helps with the symptoms that result from the disease. And it's highly effective at keeping those symptoms at bay throughout a patient's life typically.